Welcome back to the determinants of health. In this lecture, we're going to ask that all-important question, what is health? Have you ever asked yourself that question? What does it mean to be a healthy person? Is it simply the absence of measurable disease? Or is it something a little more complicated, like being happy? If it's being happy, how do you measure happiness? Is it possible to be physically unwell but emotionally happy? In that case, are you healthy? Is it possible to be physically perfect but emotionally unwell? In that case, are you healthy? When you stop and think about it, the question gets pretty complicated pretty fast. So let's proceed. Now here in my title here, I've distinguished between healthy and healthful. That's because I'm a bit of a grammar stickler. So people are healthy. Things that affect our health are healthful. So eat healthful foods. But I've lost this battle. Healthy is fine. If you say healthy, I won't criticize you. Just be aware that grammar says otherwise. Okay, so what does it mean to be healthy or healthful? Well, healthy in this case. Does it mean to be free of disease, as I mentioned? Does it mean to be happy? Does it mean to be socially active? That's an important consideration. Sometimes we don't think a person is healthy unless they are actively engaged in their community with their friends and their family. Do you have to be physically active on a daily basis to be considered to be healthy? Yes, we know that physical activity is important to become physically healthy, but is the act of physical movement a healthy thing in and of itself? What about the feeling of not being constricted? Right? I have freedom to move in my life, in my job, in my community. Maybe that's an indication of health as well. It's complicated. So there are different ways of seeing health, and we have a variety of models for conceptualizing the idea of health. So we're going to talk about three of those models right now. This is an example I've taken from the Ontario Health Promotion Resource System. I want to give them credit for this. And they asked the question, what causes heart disease? And they asked this question of three professions: a cardiologist, a fitness instructor, and a social worker. Obviously, the cardiologist specializes in all things related to heart disease, so you would think that person would have special kinds of insight. However, we know that being fit is important to prevent heart disease, so the fitness instructor would have some special insights. And we know now that from a deterministic point of view, other factors can come into play in whether or not we are heart healthy, like are we eating the right foods, are we engaging in our community, are we moving about, are we getting enough sleep? And these are issues that a social worker might care about. So the cardiologist would say heart disease is caused by hypertension or your family history or maybe plaque in your arteries. The fitness instructor might say that heart disease is caused by all your behaviors, your smoking, your lack of exercise, all the booze that you drink, all the fat that you eat. And the social worker might say that heart disease is caused by stress or your impoverished state or the fact that you're not employed and therefore can't find the right foods or the fact that you feel depressed and aren't talking to your friends. So we think of the cardiologist's perspective as being the biomedical model. He or she is looking at this from strictly a physical, medical perspective. The fitness instructor is looking at your behavior, your choices. Right? So we call that the behavioral model. And the social worker is looking at the various factors in your social environment. So we call this the socio-environmental model. So in the biomedical model, essentially we're saying, is there disease, yes or no? And some kind of measurable disease, some kind of indicator, some test that we can use to detect something in your blood to determine are you diseased or not. In the behavioral model, we would say that health is the outcome of lifestyle choices, like your choice of whether or not to smoke or to eat certain things or to exercise. And in the socio-environmental model, we say that health is some complicated combination of social, economic, and environmental determinants, and maybe some incentives and barriers for getting healthy. For example, maybe you eat fatty foods, but maybe you eat fatty foods because you can't afford the healthy foods, Or if you can't afford them, there are no good grocery stores in your neighborhood that sells healthy foods. Or if there are, you can't get into them because you're disabled and they're not wheelchair accessible. So there are factors in your environment that prevent you from being heart healthy, even though you've got good behaviors and you've got good family history. So this table summarizes those three models and looks at how we tackle heart disease depending upon which model we arise from. So in the biomedical model, as we mentioned, we assume there are tests we can conduct to determine whether or not you are healthy. And so our strategies will be drugs or treatments, something that looks at or addresses the causes that we've identified in our paradigm. In the behavioral model, the strategies will be things like education or some kind of advocacy for changing your life choices. And in the socio-environmental model, our interventions would be policy change, things that government can do, advocacy work, changing our environment. Now, in the biomedical model, it's important to remember that disease progresses in a certain linear fashion. We have something called the preclinical phase, then the clinical phase, and then we have the outcome of that disease state. So think about cancer for a second. Yes, different cancers behave differently, but in most cancers, you would develop a tumor early on, but maybe there are no symptoms, and there's no test you can do to determine whether or not that tumor is growing. It's at the cellular level, let's say. So the biological onset of disease has started. The symptoms don't appear until some time later, and the symptoms might be rather mild. You may not even recognize them as symptoms. Okay? So they have to be severe enough that you actually seek medical care. This takes place in the clinical phase. Once you seek medical care, maybe you're coughing up blood. Maybe you're vomiting a lot. Maybe you're not sleeping or you feel lethargic. These are all signs of some kinds of cancers. And so we do a biopsy, and there's a diagnosis. The diagnosis may be correct or may be incorrect. Science is not perfect. And then, only then, therapy can begin. But look how long along that process it is before we have any kind of treatment. At that point, there's a short jog to the outcome. Oops. Let me move ahead here. And the outcome is either alive or dead or cured or something like that. So this causes us to think about early diagnosis. If we can diagnose earlier, we can start that process of treatment early. We can start the diagnosis early. If we have screening tests, we can get in the preclinical phase. What's a screening test? Well, it's a test we can do for you if you're not showing any signs or symptoms, like a prostate serum antigen test, which is given to men to determine whether or not their prostate is growing at an unusual rate, or the digital rectal exam that are given to men to see if their prostate is inflamed in some capacity. These are screening tests that we often do prior to the appearance of symptoms that would cause us to do diagnostic tests. That's a biomedical model. Keep in mind that according to this model, you don't enter the system until you've got symptoms. At that point, and only then, do we have data about that disease. So think about a pyramid or an iceberg. It's at the top of the pyramid or the top of the iceberg where we have a diagnosis, and therefore this is where the medical profession really comes in. It's all this other stuff under here. That's where the non-biomedical models come into play. The biomedical model starts to assert itself above the water or at the top of the pyramid. But the socio-economic model and the behavior models all assert themselves down here. So this is the WHO, the World Health Organization's definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a very important definition. It took experts a long time to land upon it. It's not perfect, and there are ongoing debates about whether or not it is the right definition. But think about that definition for a second. What does it mean to you? It specifically says it is not merely the absence of disease. It's something else. Physical, mental, and social well-being. This opens the door to all sorts of things. Now, some people include spiritual well-being, and we're not sure exactly what that's supposed to mean. I remember being called in to assist a public health unit devising their health strategy, and they had decided that they want their community to have physical, mental, social, and spiritual health. But they didn't want spiritual health to mean religious. If it's not religious, is it mental? But we already have mental health in that definition. So I like to think of spiritual well-being as something around purpose. Does an individual have a sense of purpose, understand their role in the universe or in society? That's a kind of spiritual well-being, in my opinion, and I think that's what the definition seeks to incorporate. We'll return to this in a second when we talk about indigenous health systems. As I mentioned, there are all kinds of debates raging over whether or not to modify this definition. So here's one attempt to do so. The extent to which an individual or group is able to realize aspirations and satisfy needs, to cope with the environment, etc., etc., etc. So suddenly we're trying to cram in all this non-medical stuff into our definition of health. The famous epidemiologist John Last, who actually lives down the street from me, once wrote that health should be a sustainable state in which humans and other living creatures with which they interact can coexist indefinitely in equilibrium. Now, he struggled with that definition for a while, and the equilibrium point was important to him because it suggests an environmental ecological component, that we are not truly healthy unless we can live in peace and harmony with those things around us, including the physical and organic environments. Let's go back to the WHO definition, though, the official one. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a politically laden definition, if you stop and think about it. Because suddenly, you could argue that maybe types of government are relevant for health. Is a non-democratic government a state of poor health then? Well, under this definition, it allows us to have that conversation. Is unemployment a state of poor health? Under this definition, we're allowed to have that conversation. Yeah. And then we have to talk about how to measure these things. Is life expectancy a rational measurement of population health? Doesn't matter how long people live. Maybe it matters, are they living healthfully or are they living productively? We have lots of old people in our society who aren't working and who are in a lot of pain. Are they truly valuable to our society? That's an offensive thing to think about, but it's a question that has to be asked. So how we define health is important procedurally, politically, economically, and intellectually. Different cultures define health differently as well. So a lot of my research takes place in rainforests. I work with rainforest dwelling communities in South America. And in one such community, I remember thinking about their definitions of being healthy. Yes, it's important to be pain-free. It's important to not have lesions on your body. It's important to not have parasites and to feel well. It's also important to be with your people. In one situation, we were trying to airlift one of their members to the city to seek treatment, and he'd have to be in the city for many months. And he said, no, that's not good enough. I know that I could die if I stay here and don't get treatment, but it's more important for me to be with my people in my community than it is for me to risk dying elsewhere. So in his perception, health was a social construct, and I would tend to agree with him. So we have to respect that different peoples, different traditions, different philosophies will define being healthy, healthful in different ways. All right? So in some cultures, being socially valuable is more important than being physically robust or measurably healthy. Ask yourself, which of your senses are more important to you? Would you rather lose your hearing or your sight or your sense of feel or whatever? Different cultures will answer differently, believe it or not. And that depends upon how much value they place on social interaction. We like to think in the West that vision is the most important thing because we do so much with our eyes. We watch movies and TV, we read, we engage in our community and our society through looking for cues. A lot of societies will say that hearing is the most important because through hearing we can speak to each other. And being able to communicate with each other is the most important thing. So these are not easy questions, they're not obvious answers. These are things we have to think about. So far we've talked mostly about Western medicine. Another word for Western medicine is allopathic medicine. And it's pretty distinct from non-Western ways of thinking, especially from indigenous, i.e. Aboriginal health. So in general, indigenous health systems are less biomedical. They're more behavioral, more spiritual, and more socio-environmental. Not exclusively so, but they tend to be more so. For example, Australian Aborigines believe that to be healthy is to have something regarding social, emotional, and cultural well-being. And they focus on the health of the entire community, not just the individual, because the individual is only valuable to the extent to which he or she contributes to that community. That's the end of this lecture, and we will see you next time.